Scattered calcifications are identified bilaterally, period. All appear benign in clustering and morphology, period. No further short-term follow-up is recommended, period. My position is Section Chief of Women's Imaging for St. Luke's University Health Network. The responsibilities of that position are ensuring that the quality of our women's imaging service line, specifically breast imaging, is of the highest quality. Regular screening mammography is really a modern medical success story. A screening mammogram is the basic breast imaging done yearly for women, usually starting at age 40. And it's a low-dose radiation study that has created really a 35% reduction in breast cancer mortality.
I am a mammographer and I've been with St. Luke's for 19 years. I've been giving mammograms every day since I was 21 and now I'm 40 and it's time for me to have my first.
50 years ago, most breast cancers were diagnosed as palpable abnormalities. So it wasn't until a woman felt something in her breast and sought medical assistance for it that we found breast cancer. With mammography, we've been able to find smaller, treatable breast cancers. And that's really where that decreased mortality comes from. It's using imaging to find smaller cancers before they're palpable masses and metastatic masses or spreading cancers.
It's good to get a good baseline and then they can compare the future mammograms to your screening mammogram, your baseline mammogram at age 40.
The new technologies that we're seeing come out are attempts to deal with screening the dense-breasted patients. Typically, the findings of breast cancer are white on a mammogram. In a woman who has dense breasts, really her whole breast tissue looks white on their mammogram. But some of these new technologies allow us to slice through that dense breast tissue, and that's 3D mammography. Where we currently are doing our 3D mammograms is called GE Sensory Suite. And what this is, it's a room where a patient can choose what type of images she'd like to look at during a mammogram, and even what she'd like to smell during the procedure.
It was very relaxing. I liked watching the video up on the TV, and it kind of made me just relax and just think of being on the beach rather than being in a sterile mammography suite.
So all this is done to relieve the anxiety associated with mammography and maybe make things like the compression on a mammogram a little more tolerable. If there is a finding on the screening mammogram, a woman moves to a diagnostic mammogram. For those exams, they come to the Regional Breast Center here. So we have all of our most experienced breast imagers working under one roof, and in doing so, our quality numbers are really, really incredible at this center. Our cancer detection rates are 10% higher than the national average, and we can do same-day biopsies. Certainly, it's rewarding finding small, treatable breast cancers and providing a life-saving service here, but also being part of a really dedicated team that's singularly focused on treating breast cancer.
We as women tend to put our family first, and I think it's important for women to take care of themselves, have their mammogram just so they can be healthy, and then they can in turn take care of their family.